Okay. What we can do is, I'll try to put the needle for this toy. Okay. So suppose we want to do Li4. Okay. So I just initially press. Okay. I just check if there is a muscle area. Okay. There is a
Mm.
muscle area. Then this is how the needle will look like. Are you able to see? Okay. This is
Yeah.
how the tube looks. Okay. In the top of that, there is a small plastic. If you remove that, it will be just a pipe. Okay. This is a pipe
Mm.
and this is the needle. Okay. So if I put the needle inside the pipe, okay, I have to just keep it on top and then duck. You just have to put the pin. Okay. So in this case, you just have to keep the pipe here. Okay. Are you
Mm.
able to see this clearly? Okay. Keep the
Yeah.
pipe.
Yeah.
You just identify the spot. You keep the pipe. You just go to the top and just put it. That's it. It just goes inside. The moment it just goes initially, and then you just have to slowly push it inside. That's
Okay.
it. Okay. So can say for example, with the help of the tube, just I just prick it. Okay. But later you just have to press it deep. Show it on this one. Are you able to see this one? I want to put it in Li4.
Mm.
Okay. Do you see the needle?
Yeah. Yeah. I can see.
Okay. There is a small thing that is my needle. Okay. What you
Mm.
have to do is you should not do it little slow. That's it. I just did a tap and you have just have to push it inside. That's it. There's a needle on my origin stream. There's a needle
Yeah.
on
Yeah.
my, yeah. So it won't pain. Okay, you just have to keep the tube. Okay, you just keep the tube on top. Okay, and then gently press that. The moment you go, it goes deeper. You just have to identify the exact spot and it goes deep inside. And then you just have to keep pushing. Little bit of practice, you can try it probably on yourself, but the only thing is you should not put it on the capillaries. Nothing will happen. We'll just ooze out for 3 or 4 drops of blood. Nothing else. It automatically goes outside. Okay.
Mm.
So you should not puncture anywhere on this line. You can do puncture nearby. Okay. You can just probably move this, and then if you want to put a puncture, you can just move it a little bit and then you can put it. But if you touch that, you will lose out. So you have to be a little careful. But apart from that, that's straightforward. Okay. Easy areas. Don't put it on the back. Put it on the hands. Put it on the leg. It's easy. ST36. You just want to put, just go ahead and do it. It's all kind of easier. LA4, because you see a lot of muscle there. You just want to press and see once. You see a lot of muscle here. No problem.
Yeah. Yeah.
You want to press it on SI2, SI3, SI4 area, you'll have a lot of muscles. You can easily put this. They are all very effective. If you put a needle, it's very, very, very effective. Okay. So these areas, probably what you can do is these are little bit half chun. They call in terms of chun. Okay. This is the length of the needle. This is the handle, but the needle is this big. Okay, it's this big. This
Mm.
is the size.
Mm.
This is the size, and then I have bigger needles, which is double the size of this. So it will be this big. So if there is a thigh, some fat person comes in, right? The small needles are not enough. Then I put a bigger size needle, it will be this big, and then there is this big needle also. You have to just go deep, just touch that. The moment you touch it here, if there is a missing tissue here, it automatically grows. That
Mm.
is the magic. If you just go and touch that deep inside, this deep, okay, sometimes you just have to go this depth. When you go that depth, there is a missing tissue here that grows. So the missing tissue is crossing the pain. The moment you puncture, this is starting to grow. So that is how this is working. And probably you can easily try on Li4 begin with. You can get a needle with tube. Okay, with tubes are very easy. It doesn't pain much. But if you just want to put directly on the Li4 area, initially you don't know how quick, because it should be very quick. Boom, it should go inside. If you do it little slow, it will be very painful. like how they put the gunshot, right? The moment you put a gunshot, it doesn't pain much. So similarly, it should be you just have to just tap it on top of the pipe. This is how it's a normal small pipe only, normal plastic pipe. You just have to keep the needle inside, and then just have to press it. That's it. Move. It just takes 0.1 second, 1/10 of the second, but quickly it goes inside. Okay, so that is how you have to put a needle, and you can do scalp also. For scalp, you have to use the Sujok needles. You can put anywhere on the head, and that is also very interesting treatment. The entire body can treat it on top of your head, and you are all done. So that is also effective. And today I recently studied one article, so I just want to put that also. I added one more slide as well, and I will probably send it to you in the WhatsApp as well.
Sujok needles are smaller, is it?
It's the smallest of all. Yes, that is the smallest. Japanese needles. So this is something which I studied recently in the article. So I just want to bring it to you. So this is also one of the distal point where in the sternum you can do a treatment of the entire body on the frontal. On the frontal side, the thoracic bones, right? This is your chest cavity, and your chest cavity. If you see the rib number 1, 2, right? Or what is this? Oh, this is the this ribs, the one which is getting connected here. This solves your back pain.
2, 3.
Yeah, this solves your back pain. And this one solves your lumbar pain. Lumbar pain is, suppose this is your chest, this is your backbone, this is your cervical, and then your lumbar, and then I'm sorry, and then your thorax, and then the lumbar, right? The first part of the this one is the cervical. The second portion, the T1, T2, T3, all the thorax points, right? They are easily treated by these two rib bones. Okay, and the lumbar, you can just try palpating. Somebody comes with a back pain, you can just palpate in this area next to the sternum and then identify what is a tender spot, and you can do glossa there. Similarly, if there is a lower back pain, you can just go little down and then you can do glossa there. It solves the lower back pain. Okay, and then this is your hand, this is your leg, and this is your foot, and this is your head. You remember, right? Sometimes, knowingly or unknowingly, there is a custom. Okay, they just put your bindi here, and then they also put a bindi here. Have you seen somewhere? If you go to the temples, so this is all because this is your head. Like how you keep the bindi here, it's not a custom, but somebody has scientifically did that and then mixed internally into the rituals. So this is your head. Any head problem, you just try palpating. If there is a pain, just do the guasa here. And similarly, your head is also this portion. You can also try here as well, and you can try here as well. The ladies, right? They after marriage they activate this. So these are all some very beautiful rituals. So this is something which I want to add here. I'll send you. I have also sent you some of the images in your WhatsApp. Probably we'll just go through them as well. Okay. So this is where we stopped last time. So you understood we have a chart. Probably can you just keep the chart with you now, because we can go through some of the use cases as well. Do you want to bring the chart?
Yeah. 1 second.
Sure. So what we did last time was we understood the system 1, system 2, 3, 4, and the sixth system is the same meridian, but you have to treat the other side. Suppose if there is a pain on the large intestine, you just have to treat this large intestine. Okay, so that is system 6. The same system, the same meridian that you have to treat. So that is system 6. Just in case you are not able to identify, system 1 is not working, 2 is not working, but somebody is coming for a pain here. You put the needle or do guasa right exactly on the other side of the large intestine. Okay, this apex, right? This portion is the large intestine. Okay, there is a pain here. I'm not able to raise the shoulder. Okay, then you identify this is a problem. You just put a needle here or do guasa here exactly on this pointer. So that is system 6. Okay, so system 6 is nothing but exactly the same meridian. And suppose if there is a pain here, okay, you can treat. You can just clone this and then you can do treat somewhere here. Okay, so that is that also you can keep it as system 6. The same side at that time If you're treating the same meridian on one part of the body, you can do it on the same side of the body. But if you want to treat on the opposite side, you can treat the opposite side as well. On the same line, you can do it on the other side. But if you want to treat a different segment, head is one segment, your leg is one segment, your body is one segment, your leg is one segment, then you can choose the same side. So whether it's the same side or the other side, this is how you have to identify. Is that clear, sir? If you want to do
Yeah.
it the same side, that means head you can treat on the hand, right? At the time you prefer the same side. But suppose if there's a pain here, you want to treat here, then you choose the opposite side. At the same line, choose the opposite side. Okay, so that is how we design. So coming back to the meridians, we will, for now, at least for this class, we will choose only the system one. Okay, and if there is an option given to you, if you want to treat a shoulder problem, okay, always try to use kidney and liver. Okay, because it balances all the meridians. If you treat kidney and liver, your heart is there, your triple ulnar is there, your large intestine is there, pericardium is there, lung is there, small intestine, everything is just balanced by these two meridians. So this is how we just have to make the sheet more effective. What you have to do is various combinations we have to identify. That way you can use minimal amount of effort but get maximum benefits, because we want to balance all the meridians. You don't know. You identify somebody is having a shoulder pain. Okay, the shoulder is in the top. So that means here, somewhere here. Okay, if there is pain here, can treat exactly the same place on your thigh, on the GB 31 area, okay, on the hip. So which meridian will I do that? Okay, the same side, there is a kidney and liver. Okay, just try treating that. So if given an option, whether you want to use kidney or you want to use heart, I want to use this one. If you have multiple options, always choose kidney and liver, because whenever you see these two, it balances most of the meridian problems on the same line. Okay, suppose if there is a problem here, then you have to do treatment here only. But where to treat? Okay, so always if that is an option, you have three meridians. Try to choose kidney, liver, large intestine. These are your favorite spots. The reason being that it balances most of the meridians. But if you see the other meridians, right? Suppose you take, for example, spleen. Okay, lung, the small
There will be
intestine.
common.
Correct. They'll be repeated. Some places, right? You see only three of them. It balances only three meridians, but sometimes they balance five meridians. So always give priority to meridians which balances all five of them or four of them. If it balances only three, then that is one of the option. But always try to choose a meridian which balances four. Okay. So this is something which you can probably start utilizing, not in the initial days, but at least to be more mature in this area. Try to reduce your treatment procedure time by using this method. Next comes this one, how to write a prescription. So always, if you want to treat the in meridian, because what we are doing so far is the hand meridian is treating your leg meridian, correct? So if there is a problem on the large intestine, okay, can you just keep your sheet with you? I'm not going to go back to that slide 24. So large intestine, on the leg you have stomach, correct? So on the hand it's large intestine, on the leg it is stomach. Okay. So if that is the case, yeah, if you have large intestine on the hand, if to make your treatment more effective, you are going to treat the stomach on the other side. Correct? So one is a yin meridian and one is a yang meridian. Okay, we'll take this case. Okay. So, so this is how you got it. Okay, but now we are going to deal it in a totally different perspective. Okay, so somebody comes to you, you put it as four different quadrants. We saw it last time, but we just want to do it one more time. So four quadrants. Okay, so somebody comes to you with stomach. So stomach is not on the hand, so large intestine is there. Okay, so another option, first option is you can do stomach. Okay, it's a problem here. Okay, you choose large intestine somewhere here and you choose ST36. ST36. Okay, so this is how you treated that patient. So this is one option. The other option, what you can do, this one is a yang meridian. Okay, now try choosing from your sheet Can you just tell me in meridian which we can use for which is balance large intestine? Can you just see your sheet and then tell me one in meridian? In meridians or the main meridians? So stomach is a yang meridian. Very good. You have liver, you have large intestine. Okay. So what you can do is you can treat your liver. So that is one option. So you do large intestine on the hand, you do liver or lung on the sorry, lung is not on your leg. Okay, it's on the hand. So there is no other option. You can do either liver or you can do kidney. Okay, so this is yes, you can do kidney or liver. Yes. So if this is yang, so this should be obviously in meridian. Okay, and this is in, obviously this should be a yang meridian. So what you have to do is, if this is lung, large intestine, okay, can you just tell me in meridian which is on the hand?
Lung is there.
Very good. So you have your lung. So if it is lung, can you go to your sheet and then see what is there against lung on the yang side?
And lung, we have spleen is there.
No, spleen is a in meridian. It's a main meridian.
UB is there.
Very good. So you have your UB meridian. So UB meridian is a yang meridian. So this is how you have to give 4 different aspects of your treatment, whatever combinations you like. Yeah, in, suppose you want to start with the in here, again it's exactly the same thing. Okay, now I'll do one more, the same 4 different quadrants. So this is how you have to write the case sheet. So earlier somebody came with you for a yangs, but this is a problematic area. Okay, so this is why they came in for you. Okay, they want to treat a large intestine problem. Okay, they came with a jaw pain. Okay, any jaw pain, right? Because this is stomach. Because your stomach meridian is very dominant here, so this is a large intestine problem. So you either treat your stomach on the foot, or you treat the large intestine this side. Okay, on your hand, whichever you want to start with. Okay, you just palpate and see ST36 or large intestine, whichever is very dominant. Okay, so if you want this, you want to treat, you assume that you wanted to treat the stomach. Okay, so stomach is a yang meridian. So obviously you have to do a in treatment here, and here you have to do a yang treatment. Here you have to do a, I'm sorry, this is yeah, this is a yang only, and this is a in. Okay, so this is how, this is your second option. Earlier you started with yang on the hand and then you derived the other things, but now you wanted to start with stomach treatment. Okay, you want to do stomach 36. Okay, so now tell me what you can do on the inside of your left arm. This is your left arm and this is your right arm. This is your left leg, this is your right leg. Okay, so what we can do on the inside, can you tell me for stomach? If you go to the stomach, what is there on the inside?
Again, large intestine only.
No, large intestine is a yang meridian. That is also another option. That is option number, that is your option number. Directly if somebody comes in, so what you can do, they come in for a problem on the, very good sir, very good. So they come for a large intestine, you can do stomach. This is also one option, but this is also yang, this is also yang. This is also one option, you can do this also. But the other option is you can do a stomach, and here you can do pericardium. Very good. And what is a yang here? For pericardium, can you check what is a yang here?
Liver is there.
No, liver is a in meridian.
In meridian. So another thing is
we have SJ, triple warmer. No, kidney is a in meridian.
Yeah, triple warmer is there.
Yeah, triple warmer is there. Okay. So now for triple warmer, how do you balance? Go to triple warmer, SJ, and can you find in meridian, a main meridian?
Again, kidney is there.
Fantastic. So this is how you have to balance. So stomach meridian, they came for ST36 problem, and then you substituted by a pericardium 3. Okay, this is a pericardium 3 equivalent for ST36, and then you went to triple warmer on the other side, and then kidney. This should be somewhere on kidney 7 or area. On triple warmer also somewhere here you can find defect where there is a problem. You can palpate and see. So this is how you have to divide, and what you can do is you can maintain a case sheet. So first time they came in, you just have to draw these 4 quadrants and then plot whatever treatment that you are going to propose. So is this fine with you, sir?
Yeah.
Do you want to go one more round, or this is fine with you?
No, I got it.
Okay. So this is how we have to write the case sheet. So always a yin will balance a yang. If you do a yang here, you have to do in balance with a yang. So this is how yin and yang works together. So in meridian, if you see heart, pericardium and lung, so heart will be balanced by the yang meridian, which is gallbladder. On the foot, you have gallbladder. If it is pericardium on the hand, you can choose yang meridian stomach. If it is lung, you can choose urinary bladder. But suppose if it is lung problem, you can also have the other option. You want to treat lung is a yin meridian, you can also treat it with a spleen meridian. If you go to the chart, right, spleen balance lung and lung balance spleen. The first one and the fourth one in the sheet. Okay, so these are the multiple options. Either yin yang, or you want to choose yang yang, yin yin, anything is fine. But always try to solve the puzzle with all the 4 quadrants to make it very, very effective. Okay, so this is what is maintained here. This is called a family. Shaoyin, Taiying, Joying, but these are the Chinese names. But ultimately, this is what they are trying to teach. A large intestine can be supported by stomach. Stomach can be supported by pericardium and liver. So this is also one option. And this is also another option. Okay. So yang meridian is balanced by yang, yin meridian is balanced by yin. So this is also another option. Yin,
Okay.
yin, yang, yang. I think I told it the other way. Sorry, sir. So yin is balanced by yin, yang is followed by yang. Because I thought I closed that. Okay. I'm very sorry about that. The yang is balanced by yang and yin is balanced by yin. But you can also do the other way, that also works. But this is a prescribed one. The reason why they tell it, the 4 quadrants, they support each other. Okay, but the problem mostly is when you put the left and the right, the problem is solved. You don't need to continue. But if the places where it doesn't continue, you do all the 4 quadrants. Because you put this and this, 2 needles, okay? And if you put the other, then the circle is complete. But most of the cases, what I've seen, I just only put these 2 only. Within that, they say the problem is resolved or it has reduced. That's why I've not mostly gone onto this one. So I told you wrong, my bad. So always a yang is substituted by yang and yin is substituted by yin. My bad, sir. So I stay corrected here. But okay. So large intestine is supported by large intestine, pericardium supported by liver. Okay. So is this fine with you? Then I'll change this one. A yin is supported by yin. And then I'll change all the meridian names. And the yang is supported by yang. So this is how we write a case sheet. The reason why we write a case sheet is that when the person comes the next time, what you have to do is you should not consider the patient as he's a repeat patient. What you have to do, your mindset should be somewhere that he's coming to us for the first time. Okay, and then he says a problem, you just have to look it on a new perspective, because now the cycle is changing. Now you understood it's a cycle change, because if you do a needle here, the entire body is now balanced. Correct?
Yeah.
The entire body is balanced. So you don't want to treat exactly the same way. Just assume the patient came in for the first time. Even if he is coming for the 20th time, you just assume the patient is coming to you for the first time. But for your records, just go through the case sheet, what all you have given, which all meridians are giving benefits for him. That way you identify what meridian is weaker, and you can make your some cases you would have seen large intestine stomach combinations doing very good. Pericardium is not helping much, so you can decide which meridians you want. Probably just it's a kind of mathematical equation that we have to solve for the patient.
Okay.
Okay, and this is a sheet which you will have. So in this sheet, it tells you which meridian is very, very dominant in that particular area. So this guy, Cole, what he did was he studied for 20 years and then he identified what meridians are very dominant in particular area. Because earlier till then, they were just putting up invisible lines, just a dash lines, which you have been seeing. But this guy, based on all his 20 years of experience, his master was also TAN. After TAN, he practiced for 20 years, and TAN died in the age of 60. And then he started his research from there, and he found a new system called body mapping system. And in this system, he generated a new concept, and he gave an entirely new picture saying that this is the problem. Okay, somebody comes with a stomach ache. Okay, we'll take a classic example. Okay, I love this example because it is very, very effective. Somebody says it's a stomach problem. Okay, if you see, first kidney will come, next pericardium will, sorry, stomach will come, and then you'll have liver. Okay, so this is the order in which your meridians will come. So if you see here, if they say there is a stomach area here, if there is a pain, okay, next time with just one needle, we can install a stomach pain. Okay, this is a very, very, very interesting one. If somebody comes to you for a stomach pain, see, you just have to observe them very closely. Okay, it's all visualization. Okay, you just have to imagine they come in for a pain. If they say there is a pain in this area, that means it's stomach. If the pain is on the center, it is kidney. This little area below the nipple, right? It's a spleen. And this area on the side is a gallbladder. Okay. Once you identify what we said, acupuncture 1, 2, 3, first you just have to very, very, very carefully identify what meridian is impacted. Okay. And what you are going to do a treatment for that, and do the treatment. 3 is easy. 2 is easy. What you have to identify, you have to do the math, you have to go to the old score sheets, what is the case record of that particular person. You can just go through them. But the first is the very, 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 very important step. You just have to identify clearly whether it is kidney or it is stomach or it is spleen or it is gallbladder. The moment you identify it is stomach, what you have to do? Just go to the other side. Stomach is balanced by either you can treat on the large intestine on the white area, or either you can treat on this color. What color is it? Is it maroon color? Pericardium. Okay, if it is paining here, can you just tell me, okay, where can I do a treatment for this patient? Okay, he says it's paining here. Let me switch on the annotate. Yes, the patient tells it pains for him here. So where do you want to be treated? Can you just give a try? You also have your sheet with you. Take your time and then tell that what option is there. Now you identify it is stomach problem. Okay, this guy has a stomach and you see the umbilical cord, it comes below the umbilical cord. Okay. Now tell me exactly, just, but when he comes, right, he will not tell that. He will just cover the center, he will just say it's a stomach pain. But you just have to ask him, even he will not know, sir, it is paining here. This is how he will catch. But you just have to identify where is the spot. You just ask him and then he will find, okay, sir, it's paining here only. Then you will identify, this is my nipple, so it is paining somewhere here. Then you identify it is a stomach problem. Okay? Because with this diagram, you are now able to identify it's a stomach problem. And then what will be your option? Just one needle. I'm just going to give you one needle or only one area, one meridian to treat on the Guasa board. So what option do we have?
Yeah, it will be large intestine between on the forearm.
On the forearm? Yes, it depends. Suppose if it is on the top of your, yes, if it is on the top of the stomach here, if it is on the bottom of the stomach, correct? Then you have to go all the way till this area, correct? Until the wrist. Yeah. Okay. If it is on the umbilical cord area, you just have to start palpating here. But if it is the pain is little low, exactly if it is paining here, right? Simply you can go here. If it is paining for me here, I'll just go little down. Okay, so that is how you have to identify where you have to treat. If it is in the upper part of the stomach here, but if it is in the lower part of the stomach, right, you just have to keep your hands, match it to your stomach, then identify which part is paining. So in that case, stomach, if you want to treat on the in meridian, right, pericardium 7 area, okay, somewhere here, if you palpate and put only one needle, the pain is gone immediately. They come with stomach pain, you take the Girard water, those things and all, right? You just identify, take a small needle, keep it on pericardium 7, just put it, 6 seconds, the stomach pain is gone. I've done this multiple times. Just only one needle. It can be pericardium 6, it can be pericardium 7, it can be 7.2, it can be anywhere here. Depends on, it's a lower pain area, I go a little down. If it is upper pain, I have to do treatment somewhere here. Do was anything. But pericardium or large intestine or doing both large intestine and pericardium, it's all effective. Okay, so side of the body, always gallbladder has a pain on the side of the body. If somebody says paining on the side, always it's on the side, on the head, on the back side of the head, it's very dominant. It's paining here. That means always triple the gallbladder, and you have to do treatment on the triple vomit on this red area. Okay, so if it is paining on the top, I also do treatment here. Okay, pains here on the top.
Where?
I do treatment.
Okay.
I do treatment.
Yeah.
Okay, so that way, but by practice, you will get to know how to map this and this. Okay, it is paining on the ear side. I'll go here, all the way here. I do treatment here. So you just have to come down. Exactly the same thing what we followed for the frontal, you just have to do it on the dorsal as well. So any questions? But in this side, right, he just clearly tells in this diagram. So if it is the stomach, do pericardium. Because it's on the other side. Even in Vasa, we do the opposite side, right? So that is one option. You can do pericardium or stomach, you can do it on large intestine, or stomach, you can do on large intestine, pericardium, what all aromas he's giving. So he's giving you two options, large intestine and pericardium. So with these two, you can easily do the treatment. Okay, and stomach is also balanced by spleen, right? But he's recommending these two only. He's saying you do pericardium and do it on large intestine. So you don't need even this chart along with you. What you can do is you identify where is the problem, go to the sheet, stomach, okay, do it on pericardium. He says stomach, do it on large intestine. If it is lung, he's saying you to do spleen, he's going to do urinary bladder. So somebody comes with urinary bladder, okay, it's paining for me on the calf muscle. And it is also paining for me on this area, okay, below your, on your spleen area. So in that case, spleen is also paining, urinary bladder is also paining. So then the quickest option is treat your lung because it balances both of them. So do a treatment on the lung here. It balances both and it gives very, very quick results. So we just identify, so acupuncture 1, 2, 3. So multiple places you identify and then see if there is a meridian which balances both of them together. Then choose that meridian and go and do the treatment. That's it. The moment you are done, it's very. So what this guy is telling is the meridians are like river flowing on the body. Okay. So his theory is it's not just a line. Okay. The meridian is very dominant in this particular area. But whatever the regular meridians we have, right? This is a regular meridian chart. So there is nothing. There is no difference. He is also saying this is your meridian. Okay, this is how your meridian is looking like. He is absolutely in sync with us. But it is very dominant on this area. Okay, and it is a river of water flowing on top of it. And whenever the river is getting blocked here, suppose in this area there is a blockage, I am having a pain here. So that means the meridian is not flowing there. If the meridian is, the energy is not flowing in the meridian in that particular area, automatically this area is becoming weak day by day. So what you have to do is you just have to prick that particular area on the pericardium or in the large intestine area. The moment you do that, you send signal to your brain, and the energy again starts to flow on the other equivalent area. The reason, if you prick this, this is working is because initially when you were created, you just were zygote, right? It's only one cell when you initially were germinated, right? And from that cell, we got multiplied into 70 trillion cells, and they are all one and the same only. The structure is all the same. And if you do treatment here, it balances this. And Dr. Tan says, if you do a treatment here, there is a missing tissue on the other side that grows. So each of them come with their own theory, but ultimately, when you do something here, your energy here open up. The moment the energy opens up, a lot of energy goes, blood goes, the carbon dioxide in this is removed, the oxygen supply is there, and the energy now starts to flow. The river has to always keep flowing. If it is flowing in the wrong direction or if it is not flowing, you form a bump or you form a pain in that particular area. Sometimes, right, if you want to treat a stomach problem, I see in the large, the pericardium area, there is a lump. And I do that, they say, it's paining there. But if I see a lump there, the moment I puncture or do guasa there, the pain gradually reduces. That means there is an energy deficiency. I just activate that area, automatically this opens up. This equivalent area opens up. So this is how the distal works. So in distal, there are multiple mapping, and one of the mapping we saw on the sternum area. If it is a back pain, you can do sternum. Okay, and so with this, we have multiple options. Either do it on the stomach, large intestine, stomach, pericardium. So it opens up multiple options. So with this way, you can be very, very effective. And this one, we have talked about it. This guy created a beautiful chart. It's on the back side of your chart. You will be able to see this easy body mapping. Any questions on this body mapping, sir? We already have talked, but if you have any questions, probably we can also discuss on that.
No, nothing.
Okay, so this case study we studied yesterday, and what I did was, when I was free, I just created this diagram. So it was my notes. I just want to share it with you, and I've sent that in the WhatsApp to you as well. So
Yeah, I saw that.
yes, if there is a pain on the UB meridian, so these are all the options you have. To make it little easier, I have put it here. So which means if it is a pain, you don't need to think of the chart. These are the three options. Either you want to treat small intestine, you want to treat lung or kidney. The pain on UB1 is gone. Somebody comes with a pain here, right? Similarly, if it is a stomach problem, these are the options: large intestine, pericardium, spleen. These are the areas. If it is on the large intestine, this is on the area. If it is small intestine, so each and everything I've tried to cover. This is SJ2 to SJ3. This is Art4 to Art5. This is liver 5 and 3, because we don't know, right? Because if it is pain here, you have to treat large intestine 4. If you go down, you just have to go down accordingly. Okay, so this is just a rough indication, but it will go above or below based on the point. But if this point is paining, then you have to treat this. But if it is not here, it goes little up, then you have to climb from SI2. Instead of SI2, you have to treat SI3. If the pain is here, then you have to go for SI4. Similarly, when you climb, this number will also increase. Okay, so this is one chart, and similarly, this is another chart. If it is on the back side, we identify it was a gallbladder problem. If it is gallbladder, always keep your heart and triple vomit. It's very, very, very effective. Any pain on gallbladder, any person coming with you for gallbladder stones, see, they never have to remove gallbladder stones. At least I would have told this to 40 people, and they would have saved their gallbladder. It was one of the patient had deformed gallbladder. The gallbladder structure itself was totally deformed. But the moment I started doing heart meridian, okay, because gallbladder is somewhere here, right? So somewhere on the heart tree, okay, on this area, if you start doing, it's very effective. They were having pain on the late nights, and the moment they started sleeping. Otherwise they did not. They had sleepless nights for more than 6 months, 8 months. But after they came to know about this treatment, I simply taught them how to do our heart. So I just asked them to buy this kit from me. So 1,200, 300 rupees. With that, they saved their heart, the gallbladder. So they just have to do heart three here, or they have to do equivalently triple bomber as well. So these are the 2 points, and it's very, very, very super effective. You don't, if there is a gallbladder stone, nothing to do, any stage, you just have to simply get them this board and then charge them for this training. That's it. 2,000 rupees maximum, they can save their gallbladder. All their stones will automatically flush out. We are only going to strengthen the gallbladders. We are not going to do anything. Okay, if there is a gallbladder problem, you can do treatment on this area on the gallbladder, or you can simply do triple bomber. You can do heart 3 to heart 2, heart 3. You can do here. It is super effective. Within the matter of 3 days, 4 days, the pain will come completely subsidized to 40%, 50%, and then the gallbladder performance will start to increase. And then I tell them to reduce their anger, anxiety, and all. Try to reduce it maximum, change a little bit of that, because it's all psychological factor which they have evolved. And then they reduce their anger. They were shouting at the top of their voice. They got irritated quickly. Even if they are going on the road, right? Somebody puts a brake in front of them, they get anger. They shout. There is a signal. They shout. They're all excited people, right? So if you are very excited, you are very angry frequently, your large liver and gallbladder are being impacted. So they get develop pain on the side of their body, or it is always irritation for them. So all you have to do is heart 2, heart 3 area, and then triple bomber here. You're all set. That's it. So 1,500 rupees, if they give it to you, you can easily solve that problem. So this is something which I wanted to share, and it is very effective, sir. Any gallbladder, any stage, we can easily solve that. And the next one, and the next class, we are going to cover only on the psychological aspect. I was able to solve some long-term cases. I just told something, and then it initiated something, and they were able to come out of their problems. So we'll also ask, because the pain, right? That aspect also, because whatever you are doing is physical. Now it's all mental, right? So it is like after bathing, you do the prayer immediately. The reason why you do that is, now you have cleaned the outer body after bathing, but you have not cleaned your inner self. That's the reason after bathing, right? We go do the prayer. It's very effective, because now you clean the outside. Now you have to clean the inside. Similarly, doing guasa or acupuncture is for the outside, the physical body. But inside, if you want to do treatment, then you have to do a talk therapy. You just have to tell them, trigger them. Just say, just change this little bit of attitude, and it will create wonders for them. Okay, so that aspect I'll give you. Probably that will be very, very useful, but it is only for the matured audience. If the person is not very mature, he will not like it. He just comes you, he gives you 500 rupees, that's it. You have to give his pain, he'll come back again for the same problem, get another 500, do the same treatment. But for mature audience, definitely that will be very effective. So now comes your another use case, wherein which you want to treat the back pain. Okay, so the back, this is the interesting portion of the back. Okay, so this is your entire back. Your back, this is your spinal cord. Okay, if you go to the top, this is your neck. This forms your neck. Okay, so you can just palpate. Anybody coming with a cervical problem, you can just say definitely there will be some pain here. Okay, and this is your top portion, the thoracic portion, and this is your lumbar portion. So all you have to do is just palpate. If suppose it is on the right side of the back, go to the right side. Just palpate on the triple bomber. Yeah, just palpate here. If it is on the other side, just try palpating on the urinary bladder. Then do the lung meridian here. Just palpate on the sides here. You will definitely see some tender spots. So how it works is, if it is a middle pain, you need not even press everywhere. Just put the needles here, because in this area you cannot do guasa. So you can put needles. All you have to do is put, if it is a middle pain, put the needles here. Yeah, back pain is gone. It's called dirty trick. That means you don't want to spend time. You just put 3 needles, 1, 2, 3. That's it. The back pain is gone. If it is on the top of the back, put needles here. If it is bottom of the back, put needles here. That's it. It's very easy. Similarly, the other side, palpate whichever is weaker. If you choose this one or this one, put needles continuously here. One needle here on the large intestine, one needle on the stomach, pericardium, one needle on the small intestine or triple warmer, whichever you identify. Okay, just put a needle here, 3 needles. Or if it is middle pain, do treatment here. If it is top pain, do treatment here. That's it. It's very easy. See, in this case, if you go back to the image, middle pain, right? This is the place where we have some muscle. Okay, you just have to calculate because in this area there is a bone. So what you have to do, because it's not exactly the same. Here I see there's a tender spot, there is a muscle there. But if I check this, okay, there is no muscle. So you have to just put needle near to it. It could be little above or below. You just have to identify if there is. See, this is a cushion. There is a lot of muscle here. I can put the needle, but here there is only bone. So I have to choose. Okay, here there is a place. Okay, you just try as I speak. Right, you just also keep your wrist. You just find where there is some muscle. On the muscle, you just simply press or you put the needle. Okay, the same reason. If you want to go deep, put a needle, or if you want to massage also. If somebody, if it pains for you, right, when you work, you just go to the other side. If it is on the top of the back, just do a massage here. If it is on the middle, do massage here. If it is on the toe, do a massage here. And this called linku. This is a very, very, very famous point. Linku. The moment you put the linku needle here or you just palpate, it's not LI4, it's little below LI4. Okay, there is a bone and this is linku. This is large intestine, this is linku. Okay, these two bones. Okay, the last portion above the bone is called the linku. Once you put a needle there or you press there, the excess energy is spent to the lower portion of your back. The lower portion of the back, right, on the screen. If you press, somebody comes with you on the very lower, on the sacral area, there is a pain. Just put a needle or do vasa or just do a massage in this area. Not an LA4. LA4 is this one. I come little down. It's called linku. It's a very, very famous point. You just press the excess energy here, will be sent there, and the pain, the long term back pain is all gone immediately. It's very, very interesting point. It's called linku. And this is linku. This is LI4. Okay, this portion is LI4, but this is linku. Okay, if there is a urinary problem, you can do this because your urine is little below this, right? Below your backbone. So the maximum you can come down. From here, you can solve that urinary problem also. Okay, so in the middle of the back, you just have to put 1, 2, 3, 4 needles. That's it. Your back pain is gone. You need not even think. You don't need to understand what is the pain, how to do 1, 2, 3. Nothing. Just put 1, 2, 3, 4 needle. Okay. Similarly, if there is a pain, 1, 2, 3, 4 needle. That's it. You will solve the back pain. Okay. First, try it on you. Whenever you get a next back pain, right? Just press here. Just do simple massage. Wherever there is no bone, there's some cushion area. Just press there. You will see a lot of difference on your back pain in the next 5 seconds. Okay, so this is a distal point. This is your frontal, this is your back. Your sujo, your color therapy, they do treatment here, right? That is also correct. But it is a reflection. It's not meridian treatment, it's a reflection. The body mapping equivalent area, you are trying to do massage and that particular area grows. But needling on the meridians, right? That is super effective. This is also effective. You can put a sujo. There is something called seed therapy, right? They just put a seed, then they will tape it out. That will also work. It will take 2 days to work. But if you just go exactly identify the equivalent pair, like how we are doing here, right? The moment you do, it takes only 6 seconds. There is a difference. This doing treatment with whatever technique that we have, if you do it exactly correct, 6 seconds it will work. Maximum 2 minutes it will work. But if you put the needle here, you palpate, it will take a lot of time, but this will also solve your problem. But our guy is super effective. But there are some places. I have seen one patient who comes with me with a lump on the eyes. At that time, I cannot do anything there. I can do the equivalent somewhere here, but for her, what I told is you take a fenugreek seed and then put it on that itself. Okay, so that also works out. So we cannot say seed therapy is not good, our therapy is good. We cannot compare. The application is different. So some places the seed therapy is good, but practically speaking, majority of the problem, any body pain, the distal guasa is the most effective. To whatever my knowledge, it's the best effective method than color therapy, seed therapy. We can proudly say that one. Our guasa, everything beyond that. If you want to take results in the matter of minutes, 1 minute, 2 minutes, then doing treatment on the meridians is super effective. But this is also effective. But this one, right? Putting a needle here, this is also effective. This takes a matter of 6 seconds, 7 seconds only. The moment you correctly press the right point, right, the dirty, you do everything, all the points. You activate here. Okay, you do acupressure. Or you use that stick and then you do clockwise, or you put a seed and then with the seed, whatever you do, it, if you do it correctly, it will resolve your pain matter of 30 seconds to 1 minute. Your back pain will be gone instantaneously. So this is the logic there. So if you see the neck is this area, okay, middle finger, and then you come down, okay. So this is your spine. This is how it works. So any pain on the spine, okay, you can easily solve on the center line. And if it is lower, I told you right. If it is lower, you just have to go a little lower. Any urine problem on the front, on your hemorrhage, you go down to the bottom. Okay, this is just exactly the same upper torso, right? Exactly the same replica. So we want to treat a hemorrhage problem, piles. Just come here, do treatment here. It is very effective. Or do treatment on the mouth. Okay, because you know your anus is your mouth. Do treatment. Just identify a tender spot. Okay, this is tender. Just do a treatment there. Do a guasa there or do massage here. It is like equivalently stimulating a hemorrhage or a piles problem. Okay, so this is how this works, and this is something which I recently studied. You can probably try and see how effective. It was very effective. I had knee pain, and then I just wanted to try this one, and it was paining on this side. Okay, probably this you can consider for your practice because this I have not tried. This is a new addition, and I've tried it only once. I've not tried it for my patient, but you can probably try it for yourself and identify. So this is also because my area of interest is wherever there is a distal way, then it's very easy. Rather than doing on the knee, doing on the elbow, you spend a lot of effort. Just simply one area, meaning it's very effective. Equivalent results will be received when we apply treatment on this simple points. Okay. So, any questions, sir? I think they're almost done. You can just think through, not a problem. You can even take 1 week, 2 week, not a problem. Any particular area we want to revisit, like how we want to write a case sheet, how we want to record, whatever there is a doubt, we can have one more session. But next week it will be a psychology session. I want to give you that aspect as well because I wanted to understand why the patient is returning back, and then I identified the reasons. So I want to share that learning also with you. But after 1 week or 2 week, maybe you can apply for some patients, and then if you want particular area, we can probably revisit that. So any number of sessions, I am okay. So the only thing is, I want you to be very clear with whatever, so that you can get maximum results out of this. So
So we will do the case sheet once again.
sure, okay.
I will be treating one patient with knee pain. No, I'll try to apply this and see.
Correct. Yes. Also try for me first the sternum whether that is working because it is a distal point. Because whatever I've shared here, it's a very go ahead, sir.
A female patient, so I can't.
Yeah. Okay, yeah. So you can probably wait for a male patient. You can try the sternum also. It's very effective. Or you can just ask them to do chest guasa by themselves. Okay, so try this one. Or if it is a knee pain, probably what are the other options? On the stomach area, you can also do some massaging area if it is possible, because your umbilical cord and your this point, right? What is this? GB20. They're all one and the same. Okay, this is your umbilical cord. Okay, and this is your umbilical cord. Similarly, on the leg there is a point. We have seen that in the electromagnet class, right? Do you remember that? You have the other chart with you. Do you have the other charts with you where we see where is umbilical chart this time?
Yeah, yeah.
Yeah, if you see what is umbilical cord, the equivalent of the knee, you can try all these options together. So you can try this one on the foot, you can try this one, and you can treat your elbows, and you can do it on your toes, on your fingers. So try all these options and see whichever is most tender, and can is quick. You can reduce number of visits for that particular patient. And if there are any questions, because the classic use case is a stomach pain. Anybody with a stomach pain in your family, right? You come to this chart, identify exactly what is the problem, whether it is stomach or whether it is spleen, whether it is large intestine, whether it is kidney. Identify which is the problem area, okay, and then do the treatment here. So if the stomach problem, always pericardium is effective. You can try that, or large intestine is effective. So see, palpate and see. Just to do guasa on this little area only. It is very, 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 very effective, and you can get very instant results. If you do it correctly, you will solve the problem in 1 minute. But it depends on the problem as well. But normal stomach aches, no complications, you will be resolving it in 30 seconds to 1 minute. But if it is advanced case, if it is a bigger problem, then it will take its own sweet time. But normal cases, regular stomach ache, which we get, right? Pains for 6 hours, 5 hours, all those will be resolved in matter of 1 minute. Okay, so this you can apply, and probably we can have a sessions for clarifying the doubts. Any questions, probably we can have a session, and then we can have it clarified, because you have to identify exactly on the large intestine. Once you do it multiple times, right, then quickly you just know, tuck tuck tuck, three areas only maximum, one above, one below, and one on the center. Okay, so if it is on the knee, right, you can do either one above or one below. So you can do all these three area, you will solve the problem. You will not even ask any other question. That's it. Anything else, we'll go to the other side. Yin, yin, yang, yang, quickly we'll do that, and you'll send the patient. If you like the patient, you can do all the 4 quadrants. If you want the patient to come back, just do it only on one. So you can take a call. So you are totally on control what we have to do. So this is all this credit goes to Dr. Han, and he is a gem of gem. He taught all this to everybody, to the public, and he dissipated out of 10 balance system. He was able to identify 6 systems, and the remaining 4 systems, nobody was able to decipher that. We have to wait for somebody else to come read the Chinese books and then teach us. But the first system itself is more than enough to balance, because the first system is nothing but this one. System 1 is more than sufficient, but there are 10 systems which they identified 2000 years back. But first system itself is enough to treat all the problems. But you have system 2. Each and every master is comfortable with one system, but everything will work. It's all the easy thing. Easy thing, if you want to start with system 1 and system 6, you can, if it is a large intestine problem, to treat here. If it is a triple normal problem, do treatment here on the other side. It will solve the problem immediately. So anything will work. Okay. So these are 6 different systems. Start with system 1. It will be very effective. And if you don't have any other hope, go to 6. The other side, it will immediately work. But try the other systems as well, based on the patient and different complications you get. And if you have questions, probably we'll have a separate session for this. And next week we'll talk about the psychology, and that is also a very important aspect that will give you a different total dimension to solve a problem. And once you are expert in this one, on the distal method, then comes the advanced distal. You can go very distal. You can do 10 kilometer distal, you can do 1000 kilometer distal, or 100,000 kilometer distal, whatever you can do. But that is little advanced. That will take some time. Practice for 3-4 months, and then probably you'll have that session also. That will be even effective if you want to treat your friends, relatives, in US, in London, you want to do, you can resolve their stomach pain in at the same 1 minute. That is a beautiful thing. The same stomach problem, you ask them exactly where it is paining, and you can do treatment from here. That will be super effective. So for that, there is some other practice. You have to get some few things. It's all cheap only, matter of few thousands only, 2,000, 3,000. You have to buy those things, and then with that, you can solve any problem. That will be very interesting. They will not first believe you. They will because one classic example was one of my friend. He knows that I'm doing this, but when I told that I was able to, he has a nose block. I said I can release your nose block. You just have to show where it is paining. He did not believe that. But the moment I started doing right, the same the in the four quadrants, when I start doing it, the treatment, he was astonished. The nose block was released in the matter of 30 to 45 seconds. So that will be very effective, very interesting. But the base, you just have to practice this on at least 50, 60 people, and then once it becomes comfortable, right, then we can go there. So very interesting. That is also an interesting subject. And then scalp therapy is another interesting subject. So once we are done with this and we have applied, then you can do the same thing. Whatever we did, we can do it on the scalp as well. That will be very effective. Somebody comes with a toe problem. If I'm not able to identify any spots, I usually do it on the scalp. That is also interesting, but we need to do a little bit of sujok training for that. How to put the sujok needles, so that we have to practice on the other area in the body. And once we are comfortable, we can go to the scalp. There is a certain instruction that we have to follow for the scalp. Once you do that, the moment I put 2, 3 nails on the scalp, the food problem will be disappear. The same thing, distal only, but there is also some mechanics that we have to understand. So, but first, this is the basic. Once you are not, I will not say this is basic. This is advanced, but that is advanced to advanced to advanced to multiple dimensions, I would say. So different dimensions. We have at the moment, if you have a food pain, you can treat here. If it is on the back side, you can treat here. On the front side, you can treat here. But then you have options on the head. So that options, but that in Guasa also we can do that. We do the head Guasa, right? Because what master has taught is head Guasa will solve all the problem, but it will not solve the problem. You have to identify exactly what is the problem. Then you have to focus on that particular area only 20 times. Then the problem is gone. But until then, we don't know which to focus. So that is one different set of mechanics that we want to understand. So they're all different dimensions. Once you know all this, right, it's like a kind of a toolkit. Once you learn this toolkit, you have n number of options, because the sternum is a new toolkit which I recently found. So wherever there is a distal option, right, I identify that and then I keep that for my record, because the moment they say back then, I just have to do treatment here on the sternum area. It's very easy, right? I don't need to do anything else. So, so I think we are coming towards the end of the session. Anything else? Next week, probably what we can do is we can do the, because I told you the wrong way initially. So we'll do how to write the case sheet, and then probably we'll go to the psychology class.
Yeah.
Okay, sir.
Sure.
Okay. Anything else, sir, or we can close for today?
No. Today we will close.
Okay.
Next week we'll do it.